Okay, good evening, Pahrump. I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump. Anyway, this is the live segment of the show. Before, the first drop-in was a rerun, and that's just, I had difficulty getting out of the office as it has been lately, besides some traveling plans, so it's been a while. I almost feel like a stranger in my own show. And not having been here to run a few live segments. So again, that call-in number is 727-8750. If you're listening, watching, some people have commented that they've been watching the show and been taking notes. So some of the old shows that I have been, they have been rerunning are packed with a lot of information. And they said they were running a few shows on COPD, maybe one of the shows, I guess this first segment was dealing with migraines and dealing with a few other common medical issues. So I certainly will await your call if I know we have some loyal listeners like Ray and a few other people that might be tuning in or might have already switched to something else and gone on to do other things. But if they're listening, they're free to call in. So let's see what's going on in medicine these days. I think in the news last week, the first medical marijuana dispensary opened up in Sparks, Nevada. When someone tells me that is in the northern part of Nevada, and I guess speaking with some other individuals, there are about 4 areas, maybe 5 areas in this town where they're actually having grow factories where people are actually growing marijuana in town. And supposedly the dispensary here in Pahrump is going to open up across from the police station. So looks like medical marijuana is clearly on its way into Pahrump. And even for the cards that I filled out for people to get their medical marijuana card, those people usually have difficulty growing or finding people to help them set that motion in play. What I understand today, someone said, was after the first of the year, it will be illegal for you to grow marijuana on your own, and you will have to be in the dispensaries. I think that's very, very interesting because we live in a very poor area, and I'm not sure why that is the case. But that's the law, and so if you are one of these people that might be affected by that, I would suggest you maybe contact your local congressman or senator, and that's not the U.S., that is the local, your local state senator or representative. Some interesting problems associated with the medical use of marijuana is the dispensaries, they cannot function. Usually the federal banks won't do business with them. They can't pay their, they can't get credit cards. They can't get some of the other things that normal businesses do. They deal entirely in cash. They have to pay their taxes in cash. They have to pay their employees in cash. So the federal government, even though it doesn't recognize marijuana as a medicinal substance, which is really totally a farce, because I can prescribe Marinol all day long to patients that need it, and that is the pure form of THC. It's very expensive, but it is a controlled class 2 drug recognized by the government having some medicinal value, and yet marijuana, being a weed or something that you can grow with a pot of potting soil and some sunlight, obviously is not. I mean, you could grow your own didge plants. You could grow your, I don't know, I guess you could grow your own opium plants, but you'd probably go to jail for that too. But we prescribe opiate-related products all day long for pain. So there are just some things that are just not fair, and that probably is one of those. So if you have any questions or comments regarding medical marijuana, and I do believe in it, I do believe it has its place. I can tell you in my own practice that patients that use that particular product have experienced a lot of relief in certain areas. In fact, some people have gone to other states and received some of the butters and creams and the other things that people use, not just for cooking, but for using it on their skin, supposedly. unexpectedly and have gotten pain relief from arthritis and things of that nature, which I don't know what the dispensaries here will have, whether or not it'll just be stuff to smoke, or will it be stuff to eat, also edibles. That being said, I guess you can buy it and then make it into edibles if that's what you're planning on doing. But I do believe it does have a purpose. I don't believe and I don't support the recreational use of marijuana. I think that that product really does do something to your mind. It really does slow you down. It interferes with your memory. It interferes with motivation. It just has some negative effects for those that really don't need it for medicinal use. And that's why I encourage people who are thinking about it to come in. I think I and probably maybe one other doctor in this town are the only physicians that will consider supporting the medical marijuana cards. And I would say that kind of goes against all of what we were trained to do to help our patients, and irrespective of what's within the law. And even that sometimes gets a little clouded when you start using medications off of what they call the FDA indications. And we do that day in and day out in our office. Some of those things are acceptable, and some of those things are, cross some barriers. And that happens a lot in medicine, meaning a drug is indicated for, let's use one called gabapentin or Neurontin. Neurontin was created as a anti-seizure medication, and of course, it didn't really do well for seizures as it did well for chronic neuropathic pain and chronic headaches. So basically, people use it now more for diabetic nerve pain. But its sister drug that has come out is Lyrica. And Lyrica is a much better drug for chronic neuropathic pain. And one of the mistakes I see being made in the community is that people are being given large doses of gabapentin, somewhere upwards of 900 to 2,800 milligrams. But in reality, gabapentin does not work any more effective at higher doses than it works at lower doses. So that means there is no dependent dose curve, meaning increasing the dosage does not give you an increasing response to that medication. So that being said, if you happen to be one of these people that have diabetic nerve pain or some other chronic fibromyalgia or one other chronic pains, and you're on gabapentin and you're on high doses, you would probably be behooved to talk to your healthcare provider about reducing that medication. You're not getting the benefit at 900 milligrams versus 300. And then maybe looking at Lyrica. And Lyrica is one of those drugs that does have a dose-dependent curve, meaning the higher the dose, the more effective the medication is. And it also is kind of in that anti-seizure, but Lyrica has actually got the indication for chronic pain. So that being said, some insurance companies want you to use Neurontin as a step edit for Lyrica, but it's an off-label use. So you can see the dichotomy that sometimes develops in medicine, where FDA approves it for one purpose, but the insurance companies are saying use it for another purpose, and they'll cover it because they don't want to pay for the new drug, Lyrica. So one of the new products that have been released, and I know I'm changing gears on you here, is Saxenda. Saxenda is an injection for obesity, and it is a product that we use for Victoza. So Victoza has now been, because it does work as a secretagogue in diabetes, producing early satiety, which is the feeling of being full and not hungry. They've increased the dosage up to, I think 1.8 is what we use for the maximum dose on diabetics, but 2.6, I believe, is what they're using for weight loss. So you can actually push Victoza up to continue suppressing your hunger and things of that nature. So again, you have a product almost like Wellbutrin, which was created back in the 80s as an antidepressant. And that's another interesting case in drugs that are have one purpose, but yet they find out another one. They used it in the psych wards, and they found out that within 6 months, most of the patients who were taking it were actually had stopped smoking. So that being said, doctors started prescribing Wellbutrin, not for depression, but they started prescribing it for smoking cessation. Well, that creates a problem if you're young and you want to quit smoking and you're on Wellbutrin, to the pharmacy and to the so-called Medical Information Bureau, which, if you don't know exists, it does, and that means that every claim you make on insurance goes to an MIB, not the Men in Black, but the Medical Information Bureau, where insurance companies that want to insure you or assess your risk or even information about you is collected. So that being said, if you were prescribed an antidepressant and then you went out to fill out an insurance form for insurance, health insurance to a different carrier at some point, and you checked that no, you weren't depressed, then they might cancel you or not give you insurance because you took an antidepressant. So they changed that medication to Zyban, which was used for smoking cessation, and so doctors could prescribe something that was indicated for that purpose. It also, believe it or not, as it was explained to me by someone, that could be quote-unquote insurance fraud when you prescribe a product for depression for smoking cessation. So, there are a lot of things that we do that kind of rough the edges, but nobody really cares about it unless they want to make a federal case about it, and they will do so. So, Saxenda is for weight loss. It is one of those things where you obviously do need to see a physician. And most people who are obese are pre-diabetic anyway. Most people that are obese are insulin resistant anyway. You don't get that way from sitting around doing nothing. You usually eat more calories than you burn on a daily basis. And that being said, obesity, and I've talked about it numerous times in this show, obesity is the precursor for a whole host of horrible illnesses, and diabetes is one of those illnesses that you do predispose yourself to when you become obese. So again, be very, very careful when you're being prescribed a drug, making sure that your physician is or your healthcare provider is labeling that drug for the purpose and for what it is indicated for. And we're going to be kind of going to break here pretty soon in a mid-break, and probably talk about a few other medications that have been given out to the public for one purposes and then turn out to have some benefit with something else. And that creates a very interesting topic for future discussions. Anyway, thanks for tuning in tonight, and we're going to go to break, and we'll be right back in a few minutes. Thank you for tuning in.